today? We're live again today on Sea Health Awareness Series. And today we shall be discussing the role of home caregivers in preventing geriatric and pediatric drug abuse. It's an exciting topic that is very common and prevalent in homes and families across the world today. We are very lucky today to have a pharmacist with us who understands how medications work, and would like her to introduce herself to you, tell us a little bit about herself, her career, and her interests, especially in the area and the subject of our discussion today. I want to welcome pharmacist Gift Wisdom Ihunwa. She's a pharmacist in Port Harcourt, Nigeria. Gift, could you please tell our viewers from across the world about yourself?
Hi, everyone. Good afternoon. Good afternoon, everyone. Good afternoon, sir. Good afternoon, ma'am. Good afternoon, our audience and our viewers. Okay, our host has already introduced me. I'm pharmacist Gift Wisdom Ihunwa. I'm a pharmacist by profession, and I'm also an addiction and rehabilitation counseling psychologist. I have special care in geriatric caregiving, and I was once a resource person into geriatric caregivers in the area of pharmacy. And I'm the head of unit theatre pharmacy, University of Port Harcourt Teaching Hospital currently. And that's all. That's me. If based on my home.
Thank you so much, Gift. Of course, we have our program officer at Sea Health, Doris. Doris, could you tell our viewers from across the world who you are once again? I know you do this every Friday, but I won't get tired getting to learn more about you.
Thank you very much, sir. Good afternoon, and good afternoon, everyone. My name is Khan Doris, and I'm the program officer for the Sea Health Department, and I'm also a geriatric caregiver.
Thank you for that introduction. I'll go back to Gift. And Gift, for how long have you been a pharmacist? For how long have you been a geriatric caregiver? And can you tell us a little bit more about your career as a geriatric caregiver?
Okay. I've been a pharmacist for 9 years, and I've been a geriatric caregiver not long. In fact, that was not even an area I wanted to venture into until my posting. And they posted me to care for the elderly patient unit, and I was opportuned and privileged to meet with our senior citizens. That's those from 60 years and above. I was opportuned to meet them, spoke with them, and then through the years, and that's been for like 4 years, not long. It's been for like roughly 3 years. I've been there for 3 years, geriatric, not a caregiver, geriatric resource personnel. So you could say like a geriatric pharmacist per se. Okay, so I've noticed that these people are vulnerable, right? And they need a lot of care. I noticed that not just dispensing or prescribing medications to them as we would younger individuals, but them, we have to take special care in ensuring that these medications we're giving to them are safe, and they are very funny because we don't see much patient, right? But if we see up to 10, it takes like the whole day because these people, they have cognitive decline already. So you have to spend a lot of time counseling them, counseling them. I have to even ask some of them, you have to get a caregiver oh, because the caregiver has to be there to, when I'm counseling you, you can't take all this information. So you cannot do without a caregiver. You need a caregiver to understand these things I'm saying and help you, with these medications and lifestyle changes that we are telling you to do. So they say, okay, okay. We had caregivers then. So some of the caregivers were employed, some of them just okay, which one would you recommend? So I've met them. I've even seen a case where I have dispensed a medication to a patient, cancelled properly. The patient came back a few weeks ago and I was saying the drug we gave did not work. I said, okay. I asked her a few questions. Can you tell me how I told you to take the drug? She mixed everything up. And if you don't take the drug how it was prescribed, it won't work. So I told her, Mama, I will recommend a caregiver for you sincerely because this thing I'm telling you, it won't work if you don't understand how to take them. So it's been an interesting journey with them. And I've had the teaching flair to teach. So the head of the SEPO, Professor Belgam, gave me an opportunity to educate caregivers. And I saw that I had that mandate to educate people. And it's been a smooth ride, sincerely speaking. It's been a smooth ride.
Interesting. Interesting. You see, that is why what we are doing at Sea Health is very important. A health awareness is very essential. To be honest with you, before now, I had no idea that we have pharmacists who are specialized in geriatric pharmacy. You always think every pharmacist is just a pharmacist. So from what you're saying, it looks like some pharmacists have to get some special training to be able to administer drugs to elderly people, which is very interesting. And there must be a reason why the medical industry wants people to get extra training or even be dedicated to dispensing medications to elderly people. And that underscores the importance of what we are doing at Sea Health, trying to pay special attention to this class of human beings who have special problems, who think differently from the way we think, and who need all the help that they could get. So I'm so excited and happy that the pharmaceutical industry in Nigeria, has recognized the need to prepare some pharmacists in a very special way to take care of aging people, elderly people, because of their special needs, because of um, you know, how they live, how they behave, how age has changed their way of living and doing things and seeing realities. So
Yeah.
it's so interesting. But how robust? How many people, how common? How many pharmacists are interested in, doing a lot more work around geriatric elderly people?
Mhm.
Because this is the first time I'm hearing about that, a pharmacist that is dedicated or committed, or this is a more trend to dispense medications or to elderly people. Is that a very common or area, and do you see many pharmacies going into that area?
Well, it's not a common area, and sincerely speaking, it's not something that has been how will I put it now? Something that has been approved in Nigeria. Right? Pharmacists are trained generally in all area, pediatrics care, elderly care, nutrition, feeding. We are trained generally. So it is you that will take special interest to decide to, venture more, study more about these individuals. We are taught about how organ decline can affect how medications work. So all pharmacists should have that knowledge. Now, you doing the extra work is on your side. It's not like there's a particular degree current in Nigeria that is being awarded to pharmacists and say, take, you're a geriatric pharmacist. No, no degree like that in Nigeria. But it's abroad, they have infectious disease pharmacists, they have oncology pharmacists, different area that people are specializing on. which I pray and hope that very soon the pharmaceutical industry in Nigeria will key into those areas, because I feel if you're not specialized, it's like you don't know anything if you ask me. But when you put your strength in one area, you would be able to, shine. It's an area where most people, not all people would love to venture in, because taking care of the elderly requires patience. Thank you. It requires a lot of patience, right? These people, you don't have patience with them, you cannot attend to them. And you know that before I came into this geriatric area, my grandmom, she'll come to when she comes to visit us, because of her urinary incontinence, she wets the bed, and you see her face, the whole room is smelling. We will not understand that it's aging that's causing it. So it's not an area where most people will want to venture, but it's an area of interest that is lacking and requires our attention.
Thank you so much. I do really appreciate that perspective that you have given to that. Yeah. I mean, let's look at it. I mean, the younger people, how many times do they come to the pharmacy? Younger people really get sick. I think that the large number of people that need medications are people that are aging now. Not all of them might come to the pharmacy themselves. Their children, their sons, their daughters, or families might pick up this medication, but I'm sure that pharmacies are always being patronized more by people that are probably from 50 and above. Those in their 20s and in their 30s, maybe malaria, typhoid, they don't really get really sick.
Yeah.
That's why it's important that pharmacists should begin to pay attention to the needs of the aging people. But I go to you, Doris. You are a geriatric caregiver, and I wanted to know what your training as a geriatric caregiver, you know, look like in terms of dispensing drugs, medications, supporting elderly people with their medications. Is this something that you guys were taught in school as geriatric caregivers? And how important was this in the training that you got as a geriatric caregiver?
Eh, Thank you very much, sir. The geriatric aspect in terms of dispensing medication for the elderly people is one key aspect that or area that we're taught during my training, because we were actually during my training we're pointed towards the importance of dispensing medication properly, right? And we were meant to believe that to prevent medication or drug abuse in the elderly individuals, okay, or among the elderly people, you have to look at careful medication management, right? Is one aspect or one key point that it was more like a take home for us, the caregivers, that we should pay attention towards that, because as these people begin to age, you see that most of them are faced with different health challenges, which result to taking multiple medications at the same time. So we were told during my class that we should pay attention towards that area in order not to let the elderly individuals abuse their medications during the intake of it. So it was a very key thing for us to take home as caregivers.
Okay. Thank you so much, Doris. We don't know why Gift is not here. Maybe she's having some network problem. But tell us, what strategies did they teach you, the strategies to ensure that, elderly people are taking their medications? When I was talking about the how do caregivers ensure that the elderly people are taking their medications and not overdosing or abusing, as well as, of course, yes, you're a geriatric professional, but then also we don't forget that we're also talking about children too, who can figure things out when it comes to medication. What are the strategies? What are the hows? What are the tips that would make this easier? Can you tell us a little bit, assuming you're teaching, geriatric caregivers on how to do this, not just why they should do this, not just to tell them that they should not allow them to overdose, but how do they what measures would they put in place to ensure that this does not happen?
Thank you very much. First of all, you have to ensure that these medications are properly organized, okay, and monitored. Secondly, you have to ensure that they are properly labeled clearly. And also
Yes, I do.
you can use medication schedules and reminder for the elderly individuals. Okay, that way they know when to take a particular medication if they are properly labeled. Okay, just in case you're not there, you can put it out there for them to see that this medication is the one they are supposed to take at that time. Then in terms of the children, we know that children are always very curious and they always want to experiment things, right? So it's proper for caregivers to guide them at the right time and also guide them well, in the sense that they need to begin to look at the fact that, oh, if this substance are kept carelessly, the children could pick it up and take it and it might harm them or cause drug abuse for them. So it is the duty of the caregivers to put them in a safe place out of the reach of the children so that they won't cause any harm to them.
Okay, thank you so much. Gift, you're welcome back. Looks like you had some network issues at some point. Well, please
Yes.
tell us, as a pharmacist, how prevalent is drug abuse or overdose among elderly people as well as children in Nigeria? Is that something that is very
Hmm.
common hearing from from families and homes?
Sincerely, it's very common, especially with elderly patients. You see, like you feel like it's not common with them, but it is common. Now, I know one thing you may be thinking that once you hear the word drug abuse, what comes to your mind is the one that affects crack, weed, marijuana, those things, nicotine, tobacco. It's more than that. That is included. That's one phase of it. There's another phase that we are not talking about that we think is not important, right? Now, most elderly patients they face the chances of drug abuse because it's very prevalent, like I said, because this our senior citizens they are prone to this negligence, right? They are neglected. They are, because once we grow and leave them, they are lonely, they are alone, nobody comes to check up on them, and the next thing that comes to them that they will take super for is either going to drink alcohol most of the time, or take this tobacco, smoke them and all that. Now, aside from that, there's something I want to debunk, that a myth I want to debunk from the general public, saying that drug abuse is just has to do with drug that affects you psychologically. No, that's not all drug abuse is. And when it comes to this category of persons, we need to watch out for the other part of it as well, right? So the other part of it is when you take no when you hear the word abuse, is when you take something, you use drug for what is not intended for, right? But there's another part that tells us that we are taking this substance without proper, when you don't take care of it properly, it can lead to harm, abuse. The drug is no longer working the what is supposed to work, right? And this is where caregivers comes in both parts. Most caregivers they only focus on the part that this patient takes maybe tobacco, that's cigarette, or take alcohol and is watching that part. There's the other part that are not watching, which is taking care of these medications that they are on so that it do not cause the patient harm in the long run, right? They're not looking at that part. And it's not just like Doris has said, it's not just preparing the medications, packaging them, putting them in a tablet pill arranger for how they will take it. No, it's ensuring that that drug is it safe for my patient. The safety now does not determine what the drug is causing, right? The safety determine on the safety depends on how you take care of that drug. How you take care of, do you store it properly? If it's not stored properly, that drug will cause harm to your patient. Most people don't know that. So as caregivers, it is your role, because drug abuse, like what our host said, is prevalent in these people because they have chronic issues. Chronic issues requires a lot of medications, and some of these medications have psychological consequences. Some of these medications may not have psychological consequences, but if they're not stored properly, it could cause harm to our patients, right? So it is the duty of the caregiver to ensure that this medication that the patient is being given to is stored properly. Check the storage. Every drug has a storage. You cannot make your soup and leave it on top of the stove without preserving it in the fridge. It will go bad now. Eat it now and see what it will cost to you. You will run, you will use the toilet, or you may even get admitted for food poisoning. The same thing with your drug. These drugs are chemical substance. If not stored properly, due to storage temperature condition, it is going to become bad and harm your patient. One, it is unstable. Secondly, where are you keeping this drug? That's another important thing that we are not seeing. We feel like drug abuse is just when somebody takes cigarette, take alcohol, and then it start making you feel high. That is not all that it is. Okay, so when you do that first part, remember I said that drug abuse is prevalent in your kind of patient, geriatric caregivers. It is prevalent in your patient. So you have to ensure that these patients do not feel lonely, because loneliness can help cause them to have drug abuse. So what do you do? We'll talk about that later. Sir, thank you very much.
So, yeah, thank you. I think we'll go step by step, and I think you're raising very exciting issues. So, drug abuse is also part of the ways that drug is abused is not storing drug very well. And I would like us to dwell on that for 1 second. And I know that when you buy any medication, they always state there, even though in very fine prints, sometimes that is very difficult to read, they always state there
Yeah,
how you should store the medication, the weather temperature, um, and several other ways they indicate. Um, Apparently, because people are getting old, if they are managing storing their medications themselves, they might
yeah,
be able to follow through with some of these things. And I'm
yeah.
going to be asking, um, so what are the proper ways to store medications, or does each medication have to have a certain way that it has to be stored, especially given
Okay.
Nigerian environment, where, for example, we have very high temperatures and people may not have air condition in their homes or fan in their homes, or a lot of,
Yeah,
and apart from the issue, what are the
yeah.
facility issues? You know,
Okay.
resources are available at homes that people should use to properly store medication.
Take the medication.
So I'm talking about, I'm a very practical person. What is the how?
Yeah.
Say we are not storing medication, but what is the technique? What is the how to
How do we store?
store the medication in our given our Nigerian circumstance? What is the what?
Setting.
Yeah, you can speak a little bit about that, but I will also get Doris to speak to. I'm sure they must have learned that in their training programs on how to store properly medications in Nigerian circumstance.
Okay. Okay, sir. Thank you very much. Please, am I permitted to give a life experience on this thing you just spoke?
Sure, you're welcome. Yeah, sure, you're welcome.
Okay. Now, I was in the pharmacy, and a lady walked into the pharmacy, right?
Yeah.
She said that she has glaucoma. Okay. She's old, like 60 something years. So she said the eye drop they gave to her is not working for her. So I asked her, may I see your eye drop, ma? Then she came with her caregiver. Oh. So this is a caregiver that was not trained. Apparently, someone that just brought come and stay with me kind of setting. Because if this caregiver was trained, she would know that what the woman was doing is wrong, right? So that's why training is important. So this lady, I said, can I see your drug? She opened her bag, brought out a nylon, opened the nylon, brought us another nylon, and then brought out the eye drop. And I said, okay, wonderful. I looked at the eye drop. There's a particular part, I looked at the storage. The storage written on the eye drop pack says store between 2 degrees Celsius to 8 degrees Celsius. So I asked the caregiver, where can you find this kind of temperature? Is it in this? Say no for na abroad na. I say okay, no be abroad o, dey Nigeria. Where dey get cold thing? She say Jesus, inside fridge. That's how she screamed. I'm like good. So this bag you're bringing this thing out from, does it have like a cooler inside that will make it cold? So that's why the drug was not working for mama. Now how do we store this drug in a Nigerian setting? Every medications have their storage. It is written on the pack of the drug. The only thing that we look out for is the expiry date, and that should not only be our concern. We should look how this drug, the storage condition. So even when we want to go and get it from the chemist, from the store, from the pharmacy, wherever the drug is being sold, if we want to go and get it, we are looking at where the person giving us the drug is bringing the drug from. So that when the person brings the drug and you look at the drug storage, okay, the storage is fine, it's okay. Because the place you went to, they say store in room temperature. You went to a place to buy a drug and the person is using fan to fan theirself. There's no AC and the drug is there. It's not right. There should be certain standard. Or you saw that the temperature is 2 to 8 degrees Celsius and the person is bringing it from the shelf. It should be in the fridge. Now, if you don't have light, because Nigerian setting, you cannot tell NEPA can just do one kind. We are all, let's be honest. I will ask them the same. People have asked me that question. But I don't have light. How do I store it? I say this is a drug that will help your health, right? It is going to tell if, for example, a particular drug called insulin used for the management of diabetes should be stored in the fridge, certain temperature, right? But you don't have a fridge. Where do I store it? Now there's I was working in internal medicine pharmacy for a while. It could be if you put if in your pillow in your room, your pillow under your pillow is cooler than any part of your house. Do the experiment and try it. So when you want to sleep, if you buy the ice block in the morning and you want to sleep, the ice block have defrost, just carry it early morning, just carry that insulin pen, put it under your pillow. It's the temperature there is cooler, just under, is going to stay till morning. Now there's a temperature allowance for all this drug, of course, right? So that's first thing you can do. Second thing you can do is you don't have light and the temperature is 8. I mean, they say ice block, don't they? I hardly saw Mr. Goswill. I don't believe that there's no solution to I don't have a fridge, because this is a drug that you will take that will help manage your figures. You should look for a solution to it.
Well,
Get an ice
anyway,
block.
I'll give.
Yes.
Thank, thank you so much, but I must tell you that this is getting complicated because I mean I don't um I can imagine grandma in the village who doesn't even have anything to and trying to worry about it. But you are saying what the fact should be and what the reality as a professional, and we know that we have problems. I mean, if it's here in America, everybody has fridge or anything. I mean, fridge is a standard in every room, in every apartment,
Mm-hmm.
we can see that now we have a problem in Nigeria. We don't have, and it's really very interesting and eye-opening you're saying these things because many people don't know why the medications they're taking may not be working because they are not storing them in proper places. But we have problem in Nigeria. What you're talking about, I mean, even remembering to put the insulin under your pillow, and then even going to go and grab ice. And this is a medicine you take almost all your life on a daily basis, chronic diseases. So I think that then it has become important that we need to train people who can manage these things. Because think about even a caregiver managing. I'm even imagining the caregiver herself or himself trying to do what you're saying. Then let alone 70-year-old man trying to
Exactly.
figure
You see?
out out herself. That's gonna be like a whole. In fact, it's another career. Honestly speaking, so it's a
Mhm.
full-time job to ensure that these medications are stored very well. And Doris, I want you to drop in here. What did you learn and what do you do? How do you manage storage in real life? For your elderly patients. How does this work? And to be honest with you, I haven't really paid attention to the story. Maybe because of where I live, it's not a problem. But now my
Mm.
eyes are getting opened and I'm beginning to say, wait a minute, that's true. Um, there was only one time I bought a medication and I forgot it inside my car and it was really under the seat. Then I called the pharmacist, and the pharmacist asked me a few questions, and then she asked me to discard it, and she come back and collect another one because I left it under the sun, and the sun was too hot that very day. So I left it under the sun for a long time. And this is a personal experience. This happened to me here in the United States, not in Nigeria, because I went to the pharmacist to buy the drug, but I was also going someplace else. So I had the drug in my car, hoping that when I get back in the evening, I'll have it. But the sun was so hot. So I don't even know what I didn't even think about it. I think I was talking to my friend who is a pharmacist too. And I started talking about the medications I got in the morning. And I think the sun was very unusual every day. He started asking me, where did I have the medication? I said, it's been in my car.
Mhm.
And he said, no, I should call the pharmacist. You know how they do in America. Even though my friend is the pharmacist, he wasn't still advising me. He wanted me to call my pharmacist. So I called the pharmacist, and the
Yes.
pharmacist said I should discard it because it has been exposed to heat much more than it's supposed to be exposed. But before then, I
Yeah.
didn't realize it. Quite frank with you, in the past, I could get my medications, leave it in my car, go for other errands. It's sitting there, and I can imagine this can happen to Nigerians too.
Yeah.
You're going to the market, you grab medication for your papa or your mama, you put it in your car, it's sitting in your car, the car is under the sun, and you're going to the market. From market you go visit your friend, from friend you go to church in the afternoon, from church you go there, the medicine is still sitting. Eventually the medicine keeps sitting in your car until you get back around 7 p.m. in the night in the house, and you bring them out. But this medicine has been sitting under the sun for like since 9 a.m. in the morning till like 5 p.m. in the evening. Is something that we
Yeah.
don't even pay attention to. And so, Doris, can you jump in here and tell us a little bit about how caregivers, can handle storage properly? And we're talking about the how. Gift has already started giving us the how. Put it under the pillow, put it to the eyes. What other hacks do we have in Nigeria? Given our Nigerian situation, what other hacks can caregivers use to ensure that drugs are properly stored? Because then if they are not properly stored, then they're not going to work well. And they may even
Um,
become dangerous to our bodies if they are not properly
True.
stored.
thank you very much. Okay, being a caregiver and having to handle patients and drug storage, right? Normally, when you get most of their medication, there are instructions on it. There are some items that they tell you when it's open for 2 weeks, after 2 weeks, discard it. So I ensure that those stars are not taken out. I leave them there so I could follow the instruction, you know, right. Then, secondly, given our Nigerian situation, you know that most times you don't have to have lights for most of the medication, that there are some eye drops that it is mandated that you have to put them in the refrigerator. So whereby you don't get, there's no light and you can't access refrigerator, you can actually get an ice block to be able to do that, right? Or rather, you look out for a drawer or a locker that is cold, somewhere that is cold. Definitely, you have to keep it away from sunlight or heat so that it does not damage the medication for the patient. So I think these are a few ways one can actually store medication when it has to patient's drugs.
Okay, so Gift, we go back to you now. Let's take another issue, that affects, aging people when it comes to medication. Let's talk about the timing, the time to take your medication. How important is that? Sometimes Nigerian doctors will write 3 times a day, morning, afternoon,
Mm.
night. Sometimes they're not specific. They're not saying 7 a.m., 1 p.m., 3 p.m. Some drugs also have particular times you have to take them. Sometimes they say take it before going to bed. Going to bed, is it before you close your eyes or 1 hour before you sleep or something like that? How important is timing? Some people say take your drugs the same time every day and all that stuff. Could you tell us how important timing is when it comes to taking medications and how this impacts the general welfare and health of aging people and elderly people?
Okay. Thank you very much, sir. Now, timing is very important, right? And I like talking about timing because I like when I want to give an example for the elderly patient. Now, with age, you know that their organs are already declining, right? How do
Mhm.
I mean? When you give an elderly person food in the morning, they don't get hungry till evening. That's because the motility, the movement of food from their GI tract to the small intestine is slow. It takes time because it's food. The same thing for drug. Anywhere I mentioned food, know that it's also the same thing for drug. And an elderly patient, aside from that, the stomach enzymes that help to digest those food is also very reduced. Of course, for drug to be absorbed into the body, it has to be for drug to work in the body, it has to be absorbed first into the body. And something cannot be absorbed if it is not dissoluted, which is dissolved in the stomach in a solution, right? That's it. Now, timing, when they say take drug certain time, um there's something called um pharmacokinetics. I don't want to use, I'm trying my best not to use medical jargons, right? I'm trying my best to use a layman term as much as possible. Now, for example, if the drug the drug needs to be a certain concentration in your body for it to be able to work, okay? That concentration, it's determined, it depends on certain factors. For elderly patients, is determined by metabolism, not just elderly, generally. Metabolism of the drug has to be metabolized for it to be used and all that. Now, this patient, when they say take drug 1 tablet 2 times daily, what does it mean? It means take drug 1 tablet every 12 hours. Why is that? In 12 hours time, the drug concentration would have reduced by half. So the available drug in the system is not enough to elicit a therapeutic action, right? So you need to, at that 12 hours time, you need to take another drug to bring that drug to another to a certain level so that it will continue the work that it is doing in your body, right? So when you see take that's why labeling of drug in terms of timing has to be done properly. You can't Drug is dosed based on time. I always say that there are some drugs that if you do not dose them based on time, it will affect the efficacy of that drug. I had a case, this one I'm talking about is not even an old woman, a young one that her organs are still working properly. Not talk of an elderly person that already has kidney decline, liver function enzymes have reduced. Now this patient, they prescribe a medication for the patient and they told the patient to take it. You know how they used to label envelope 1-1-1. Very funny. Nigeria is a very funny place. And that is take one morning, take one afternoon, take one night. This person that prescribed this medication for, she's a lady. I know we ladies don't like eating much, right? We have time when we used to eat. So 10 o'clock, she takes her breakfast. She took 1 tablet. 2 o'clock, she took her lunch. She took another tablet. Between 10 and 2 is 4 hours. It's not even up to. 3 times a day means take it in 8 hours time. Dinner, she took her dinner by 6. She took another one. She called my boss and said she almost died because the drug started developing, like she started experiencing more like an overdose of this drug. Now, when they say take it 8 hourly, means at that 8 hour mark, half of the drug has left the body. We need to augment the drug concentration so that it will elicit a certain action. So if you don't take it like that, you will experience drug overdose effect, or the drug, if you exceed that time, you may have treatment failure. The reason why you're taking that drug may not be achieved. For elderly patient, it is worse because even that 8 hour, hold on, sir, even that 8 hours mark for our elderly patient is even too early. But we just have to stick to it because even at that 8 hour, we can't even tell that half of the drug have left their body, of course, because of their organs. But still stick to the time that it was prescribed for the patient. Otherwise, the patient will either experience toxicity of that drug or treatment failure of the drug.
Thank you so much. Very interesting thing. Gift, I have to be honest with you, you are really raising um, very important issues. And I hope people listening will learn a lot. And this is not just, to be honest with you, it's not just for elders alone. And you'll be so surprised how many people who don't even know what you're talking about. And that's the reason why we're having this health awareness. Because I'm a Nigerian myself, and I come home and I go to the pharmacy and get a medication. They don't tell me to take it every 8 hours. They'll just write one, two times daily, one times one daily, or two times one. You know how the doctors write it
Yeah,
and
yeah.
just write it. So now, I'm sure many Nigerians are hearing from you for the first time that when a medication is said take 3 times morning, afternoon, night, it means 8 hourly gaps. Or when a medication is say taken 2 times in a day, it means 12 hourly gap. This is something here in the United States, of course, yes. And if you read the labels, which many people do not read,
Of
because
course.
written in those labels, you will see that it's clear in that label to be taken every 8 hours, to be taken every. But when the pharmacists and the doctors write those things out for us, they are not as specific as they should be. And if young people who are alert and or like this lady, doesn't understand it that way, tell me how a 75-year-old man or 75-year-old woman is already struggling with dementia, or the mind is getting weaker, would handle this. Now, while we encourage pharmacists and doctors to be very clear when they make prescriptions, of course, we can't change all of them at the same time. So that's where caregivers become important. And Doris, I'm going back to you. So how do you make sure that your patients take medication at the appropriate time? And I'm a practical person. I love techniques. Um, so what techniques, what resources, what tools, what equipment have been designed? The thing I like most Western world is that they make a system impossible for you to default on that system. They make it impossible for you. Our own in Nigeria, sometimes we leave things to the discretion of the person. Sometimes here in America, the technology makes it difficult for you to default in a system, especially things that are going to cause life threat, that will threaten life. Just like the airplane, sometimes if the pilot tries to do the wrong thing, the airplane will not even allow the pilot to do it. So what structures, what resources, what systems have you put in place to make it at least very difficult for elderly patients to skip their timing, or to make it easy for them to be able to take their medications at appropriate time? How innovative are caregivers becoming with ensuring that and providing resources and techniques in place? Share practical examples and tools that you have devised and you are taught in school or you use to ensure that these things, that our elderly parents take their medications as when due. You're
Thank you
muted.
very much, sir. Thank you. As a caregiver, one of the instruments that I use is medication organizer, right? That
Yeah.
helps me to put these medications for my patients accordingly. So I know this is for morning, this is for afternoon, and this is for night, the dosage and all of that. Then I also use medication reminder, okay? Like something to remind you that, oh, it is time. Just in case I am not there, maybe something takes me out of the house. When I'm stepping out, I get to set the timer so that if I'm not back and it gets to that time, that reminder reminds the patient that it is time to take your afternoon dosage, and the person does that. And I also use scheduling, where I have to write and impute in a system where, oh, these medications, this was instruction that was given to me by the doctor or the physician or whoever that must have prescribed the medication for the patient. I schedule them accordingly, which helps me to put in the timer at when due. So I think it's something that every other caregiver should be able to use, and it really helps in making sure that they take their medications appropriately.
This is very interesting. I like the reminder part. I like the timer part, and this is something that is almost in every phone. In every phone, every phone has a reminder. I use my phone a lot to remind myself, before we started this webinar, my phone reminded me when it was 10 minutes to the time. that is 10 minutes to the webinar. So, and I hope that our caregivers should be able to also teach our aging parents. I know that some caregivers are full-time, sometimes they are part-time, sometimes they come in the morning and go, depending on the arrangements, or the engagements or the contract. But I think setting a reminder, probably on the phones of our aging parents, to remind them when the time is there. Because even if you write a reminder on the wall and put, is it not somebody that is awake as at that time would be the person to see that it is time to take the medication, or even the person that his or her mind is together? So thank you so much for giving us those techniques and those tricks, those hacks that we can use to ensure that not just aging parents, not just our aging parents, everybody, because
Yeah.
it's not the elderly people alone that have chronic diseases. I have people that are 20 something years old that are diabetic and they have to take their medications on regular basis. So, and they're busy, they're working, they're driving, they are moving about. So having a reminder, to remind you, oh, it's time to take my medication. I think it is something that is very interesting. And thank you for letting us know about that. But Gift, I'll go back to you again. What other form of drug abuse are we talking about here? How about overdosing? Like taking more at the time that you're supposed to take. So I take paracetamol in the morning, the pen is not going, even though they asked me to take two, but it's not going. And I feel like, oh, maybe I should take a little bit more so that it would work. How prevalent is that among elderly people? Is that something that comes from the fact that they are always chronic, they are always sick or having pain? Or is that something that comes from the fact that they get confused a little bit more and they may take something in the morning and forget and take it again? And sometimes they don't remember whether they have taken the medicine or not. How overdose, what are the causes of overdosing among elderly people, and how dangerous is that when it comes to drug abuse?
You've already answered the question. Because elderly people battle with a lot of issues. Chronic pain is one of them, right? And for chronic pain, they feel like the regular dose of their paracetamol or ibuprofen is not sufficient. So we even go as far as telling you to give them something that is stronger, and maybe for the kind of pain the person is facing, medications that are psychoactive may be prescribed, like tramadol. Take for example, our elderly patients, because of their age, may have ulcer, right? And if they have ulcer, there are certain painkillers that may or cannot be prescribed for them. Even when it is prescribed, another drug is added. So most of them will say the doctor may likely prescribe paracetamol slash dihydrocodeine combination or tramadol for this patient. Now, tramadol is a very potent painkiller, right? So when they take that, it helps with the pain, but it also have other effects. Now, drugs work differently because this drug has a tendency of stimulating the psychoactive center in the brain. They will take it and they are okay with the pain, but they start feeling like they just took alcohol and they are high and they love the feeling of euphoria, right? They are happy about it. And then the next time they'll say, hey, don't give me that one with the cause ulcer. Give me tramadol, give me this one. They will even keep the sachet. And then they don't come back to the pharmacy or the doctor anymore to request for that. They just take that sachet and go to the chemist and say, see this drug, give me, I get pain. The pain is serious. And then they dispense the drug to this patient. They keep taking it. Now, one thing with this drug is this: because they are psychoactive, there's something called drug tolerance. Drug tolerance is a situation where the same dose you have been taking before to handle the pain is not sufficient anymore to handle that pain. So hence, you tend to take a higher dose. Note, the fact that you took a higher dose does not mean that you have masked the overdose effect of that drug or the toxic effect of that drug. It doesn't mean you have masked it. It is still there. So for example, let's say the maximum daily dose for this drug is 300 milligram. And 300 milligram means maybe you took 3 tablets. That's the maximum daily dose they're supposed to take. Every drug has a maximum. And then because you've taken 2, it's not working. You say, make I increase that to 4. You have exceeded the maximum daily dose. Even if it's going to work for the pain, the overdose effect will not be masked. You will still be a victim of the overdose effects. Secondly, These people are old. I cannot, when I'm talking about old patients, I cannot rule out their organ function, because one of the important organ that helps this drug to be safe in your body is the liver. It breaks it down to a non-toxic toxic substance. Now your liver, it has shrunk in size due to age. The enzyme produced is also reduced. So the ability for it to work optimally has reduced. So this drug are left in your body. This toxic form of the drug are left in your body without proper metabolism. So you as the elderly patient, you are exposed to that as well. The second thing that can that can expose them to drug abuse is, like you said, the ability to remember. They have cognitive decline. They've taken this drug, the drug is said, the doctor said take once a day, and they forget and say, I don't know whether I don't take am. I had a case like that. I cried for this lady because the daughter was even crying in front of me and saying, now her mom used to remember that years. Now she cannot even remember if she has eaten at all. As someone that cannot remember if they have eaten, is it the drug that they want to take that they will remember if they have taken it or not? So do you get? So cognitive decline can make them forget that they are taking this drug in the morning and hence tend to take it in the evening. If that drug is a drug that their that the window of causing toxicity is low, what do you think will happen to this patient? They will either be a victim of drug abuse or drug misuse, which could be detrimental to their health. So there's a case of chronic pain management. Because of the pain, they want to take more. And because they want to take more, the overdose effect of this drug is not masked. Secondly, there's cognitive decline. They cannot remember that they're taking this drug in the morning and decide to take it again in the evening, exposing them to side effects or unwanted effect of the drug. Thirdly, there's a case of uh, um, grief or bereavement. Now, most of them take drug because they are not unable to sleep because maybe they lost someone or they are grieving for someone. No, with age, a lot of people just leave you. You're just alone. You've lost your spouse, maybe your kids and all that, and you're feeling lonely. To cope with that loneliness, you can't even sleep at night. You just go and get a medication for sleep. You take one tablet, you sleep. You keep taking, as you're taking it, the threshold of how the drug will work to initiate sleep will increase. Instead of taking one again, the next time you go is two, before you know, three, just so that you can sleep. So they don't do this thing intentionally. It starts with a problem and then escalate to something bigger. Thank you, sir.
Thank you so much. Very interesting and very inspiring. Doris, we're going to go back to you before we then do our last, take our last question and then wrap up. It's almost getting to one. It's almost getting to 1 hour. We started. Now, speaking about overdose, again, I go back to you as somebody that is in the field dealing with elderly patients. And let's not forget also that children are also part of the problem. And I know we have not spoken about them, but I know that we have to also look at how we control children from taking medications that they're not supposed to take. So Doris, how do you manage prevent your patients, your people you're taking care of? How do you prevent them from overdosing, taking much more than they are supposed to take? How important is the role of a caregiver here in trying to prevent overdose?
Thank you very much. Okay, I'm just going to share an experience, right? I have taken care of a patient that had diabetes, right? I've equally taken care of a patient that lost a loved one. Okay, so as of the time when I was, employed as a carer, she was mainly dependent, or she was heavily dependent on sleeping pills because she was unable to sleep as a result of the loss of her husband, right? So as a carer, I was able to try to talk her out of it. I also had to seek for external help from counselors. Okay, I also have to, speak to the family members about it, and also we had to get her involved in constant medical consultation, and also try to engage her in other social activities just to get her mind off from being dependent on that medication, because she just feels that, oh, if I don't take this medication as much as I should, I won't be able to sleep. So the constant supervision from me, the carer, the counselor who came in to also try to help her and also getting her involved, like fully engaged in social activity. With all of this thing wrapped up, we were able to get her to reduce her dependency on that sleeping pill that she was constantly taking. And of course, it helped her, and it also helped her emotionally, right? So that is one case. Then the case of the other patient that I took care of that had diabetes, frequently she wants to take much of the insulin, like she feels, oh, I should drink Coke. Once I drink Coke, I can take insulin to calm me down. So as a carer, I try to let her, yes, as a carer, I try to let her know that this is you risking your life or risking your health, right? You shouldn't be doing that. That is where we come in. We don't just focus on giving you the medication. We also try to support them emotionally, because being on constant medication is actually not easy. It's not an easy thing. You see them, they are depressed, they are that feeling of committing suicide, that those thoughts begin to come in, okay, because these people are constantly living on medication. So that is basically most of the work that we do as caregivers.
But when the caregiver is not there, some caregivers are not there 24/7. I mean, when my sister was sick, she had a caregiver, but the caregiver came in like morning, spent some hours, and maybe came back in the evening because the caregiver has so many patients to care of. When you are not going to always be there, you are not a living caregiver, you just come and go. What structures would you put in place to ensure that your patient cannot overdose?
Okay, that's where you have to keep all medication. Just I make sure I ensure that the medication that I put out there is the exact ones that they need to take. Other ones I get to hide it away from them so that they don't have access to it.
Thank you so much. Okay, that's really very interesting. You see why. So, one more last question before we then talk about the importance of caregivers. Of course, from all our conversations, it's becoming very clear to everybody that having caregivers, especially to take care of our aging parents and grandparents, has become very critical. It's no longer an option. Um, what, what, tell me a little bit about other factors that impact drugs in the family among caregivers. I think, Gift, when you started out, you mentioned about drinks. And so I'll ask Doris here because she's in the field with the caregivers. I know you're in the pharmacy, they come to you. But what do you see our aging parents doing with drugs, with other kinds of drugs other than medications, like tobacco, alcohol, liquor, weed, and all those kind of things. So, do you think that aging parents resort to some of these things? Do you see a lot of them stocking up cigarette, tobacco, beer, Guinness, and the alcoholic drinks? And how do these impact? Probably Give to answer that since she's a pharmacist, but just tell us how prevalent, how common, and why do you even think people are doing more of this in their homes, aging people? So can you speak to this a little bit?
Okay, well, is the fact that they have to um get high. Like you see most of the aging people, they are lonely, they are depressed, they are that anxiety and of course feeling of loneliness and grief. Okay, for some people that do it, it's not because they want to do it. It's not because they want to get high. They want to actually take these things or take weed or drink much of the alcohol. But because of that feeling of loneliness, maybe they are grieving over a loved one. That's where you see that most of these things coming. They just feel that, oh, if I take this alcohol, if I take 5 bottles of alcohol, if I sniff that their what's it called, snuff, I will be fine. So you see most of them do it and not even knowing that this is very harmful to their health.
But is it
So
prevalent? You're saying most. Is it prevalent?
yes,
Elderly
it
people,
is.
because I know
Yes,
young people take beer, take rum, take cigarettes, but do old people also take these things, and how common is it?
it is very common. I would say 6 out of 10 old people do that because they feel this is their some of them feel it's their last resort. This is what will make me happy, right? So let me do it and be fine at that moment.
Is this about what to make them happy, or is this about habit? I mean, if somebody was taking beer as a young person, it's most likely that he would like to continue to take the beer that he liked to take, you know? So it may not just be about being high, but it's taste. I mean, you all like taste. Everybody like to, I feel like I like ice cream. So maybe the person used to take a lot of alcohol when he was a younger person, you know, like ndị Igbo na-asị na mmadụ na-ata nkwụ or something. So if you're a young man that used to go to party club and take beer, when you get to 60s or 70, I'm sure that taste of the beer that taste bud will still be there. So is it largely a habit then, or is it largely a new development as a result of their situation?
Well, I would say, for me, I would say from the ones I have managed is as a result of their health issues. Yeah, the challenges they are facing.
Okay, so Gift, tell us what complications come with, elderly people taking beer, taking snuff, taking cigarettes, and how does that impact the drugs that they take?
Okay. Now, elderly people taking those things, how it impacts them. Now, first of all, this alcohol that they take, this snuff that they take, surely alcohol depletes vitamin B, right? And when that happens, it can cause brain issues. Call them, I don't want to call the name, but Meniere's encephalopathy can cause brain issues. Okay. Now, with them, and they take a lot of alcohol, it can cause liver damage.
Oh, wow, network. Okay, I think that Gift may be having network issues. We can't hear her anymore. Yeah, I think she may be having network issues, So, but Doris, let's continue. So, given all these situations, how important, um, okay, well, Gift is back.
Oh,
Yeah,
sorry,
sorry, I think,
call just sorry about that. So as I
okay.
was saying, I mentioned that the liver is an important organ for drug to be broken down, right? And then if you
Mhm.
take alcohol, what it does is it affects the liver more. And when the liver is affected more, the drug you are taking, they are not broken down to a non-toxic effect. The liver metabolizes this drug to enable them leave the body seamlessly, right? Now your liver is already compromised because of age. Now you're taking alcohol to damage the remaining parts. So it means that this drug you are taking, they will still be in your body for a long time. The drug does not have to stay in your body. It has to do its work and leave. That's how it's made. And the organ that makes it to leave is the liver, taking it to the kidney that removes it completely. So when you take alcohol or these drugs, it is those organs that they go to damage. And when they do that, when you take your regular drug, the drug cause other effects on your body because they stay longer, causing more of your kidney problems, bone issues, and all that, brain issues as well. So taking this alcohol, taking this being addicted to these drugs, drug abuse, taking snuffs and nicotine, tobacco, it causes effect on your organ. And these organs are important to allow this drug leave your body seamlessly. If this drug don't leave, they stay in your system longer and cause problem. That's
Thank you
it,
so
sir.
much, Gift and Doris. We are coming to the end of this session, and it has been a very inspiring session. I personally have learned a lot from this session, and I'm sure that our viewers from all over the world are learning quite a lot. And I know that in the case of children, we just don't allow children to take medications themselves. They just have to be given the medication when they are, under certain age. So that one is as simple as that. But in the in this scenario, based on all you have said with regard to medications, how important is it now for, aging people to have caregivers? How important, how critical is it? What role would caregivers play in the overall health and probably longevity of aging people? So, um, Gift, how important then? Because from what you're saying, honestly, I mean, it's gonna be hard for an old person to deal with all these things you guys have been saying here. So, has it become a must-have, for every old person, must-have, a caregiver, has it become a must-have for every old person? So, tell us how important this has become now.
Yes, having a caregiver is an emergency for your elderly, more aged parents is an emergency, trust me. Because the doctors, the pharmacists, the nurses, the occupational therapists cannot be there at the same time, right? To ensure these instructions are being carried. But these caregivers, they're the ones that we've impacted some of this knowledge to be able to take care of your needs. So if the doctors are not there, the pharmacist is not there, the nurses are not there, these caregivers, trained professionals, they give out this care to your parents, to the elderly patients, to the older citizen. Because like I said, I've said a lot of, because these people, their brain decline has gone down, their brain memory has gone down. So what am I trying to say? Having a caregiver for your elderly patients cannot be overemphasized. That is the truth. Because without them, the death rates for elderly people will increase. Why? They will underdose, they will overdose, something will just go wrong. So caregivers is like that caregiver, that final touches that it makes healthcare complete. So without a caregiver, it's like you have given the instruction and it is not implemented. Nothing is being done. Because they can't implement it themselves, the caregivers help them to implement the instructions that other health personnel has given. Thank you, sir.
Wow. Beautiful. Without the caregivers, it's like giving instructions that are not implemented. That's the icebreaker. That's the point to go home with, because caregivers implement the instructions given by doctors, and the aging parents cannot implement this because they don't have the mental capacity, the physical ability to do this.
Yeah.
Well, thank you so much, Gift, saying that we all need caregivers for our aging parents. But where do we get the caregivers? Where are we getting them? Where are they? Are they in Nigeria? Are they in Port Harcourt? Are they, where? How do we get them? Because we have all these our aging parents. They'll go and grab somebody from Akwa Ibom or from Abia State, and then they say, it's Medo, it's houseboy, and these house boys and house girls are not trained. Because I'm sure when you're talking about caregiver, you're talking about trained ones, not just
Yeah. Yes. Trained.
Ekaipe or Chidinma,
Mhm.
that they went and carry from the village and bring the person to the city, and they don't know what they are doing. So where do we find trained caregivers? Maybe Doris, you can jump in here. Where do we find trained caregivers, and how can caregivers or people that are already providing care can be trained? Is that part of what you do at Sea Health? And tell us a little bit more so that our viewers, because you guys, with all you have said today, you have scared the viewers, and maybe they would want solutions. So where is the solution?
Okay, thank you, sir, and thank you for Mrs. Gift for doing justice to our today's topic. We all know
Thank
that
you.
now that getting a trained caregiver, not just anybody, not just somebody in the village. You have to get a trained caregiver, professional trained caregiver for your aged parent and for your children, right? So as Sea Health, it's part of the job that we do. We have professional trained caregivers who render caregiving services to our clients who need those services. We also train caregivers, okay, at Say Health. And we also sell medical equipment, all kinds of medical equipment, ranging from glucometer, your BP machine, your wheelchair, your white cane, and every kinds of medical equipment. We sell them at Sea Health. And we also do health insurance plans for your aged parents, for families, individuals, your children, because it's a very important aspect, okay? Because nobody knows when sickness come knocking. So it's very important that you get health insurance coverage for your aged parents in the village to enable them access healthcare at every point in time, just in case you know that.
Okay, thank you. But how can anybody reach you? I mean, if somebody is interested in getting a caregiver or getting his or her med trained by you, how can somebody reach you?
Okay, our head office is at number 17 at Joko Street, behind UBA Bank, Weja Road, Owerri. Or you can call our phone on 0704 600 7185. I repeat, 0704 600 7185. Or you can also reach us via chealth.csaae.org.
And that's chealth.csaainc.
inc.org, yes.
Thank you so much. And we hope that people will do the right thing for their aging parents and the children by going all out for caregiver. Thank you so much, Gift. You are such a very intelligent pharmacist. You're such a very smart woman, and we have learned a lot from you. I think we'll bring you back here again, and I think we're planning also a training for meds and houseboys sometime in August. I hope that Doris would have to make you one of the trainers that time because it looks like you have a lot of knowledge about how to manage medications because aging people and medications are five and six. You can't, then once we start getting old, we need medications to support us. We can no longer, our natural abilities will decline and we need medications. I don't know anybody 60 and above that I
Yeah.
know is not taking one medicine or the other. Even from 50, people have started developing chronic illnesses. And here in America, people live up to 100 with their medications. Everybody has a medication cabinet and everything, and they are very religious
True.
about their medications, and that's why they are living longer. Maybe our Nigerians' longevity is 53 years old in Nigeria. So maybe if we start taking our medications very seriously, maybe we can also live up to 100. Maybe there's something we're not doing right about medications when we start getting old. And that's why probably we're not living as long as our counterparts in Europe and America. So thank you so much, Gift. You have really taught us a lot today.
Thank you
I'm
so much.
very grateful and humbled by your level of understanding and competence in this area. So what is your final words, your last word to all our viewers from across the world? Just 1 second.
I just want to tell you, thank you so much for joining. Thank you so much, sir, for having me. What I want to say is this: do not take medications if they are not prescribed for you. And also, I want to also tell you that medications are not your companion. As an aged person, medications are not your companion. Do not take medications if they are not prescribed. If you do not understand how to take medication, ask your pharmacist. And also, for those of you that have aged parents and you're leaving them here without caregivers, I don't want to say negative words. So I hope you're not ready to bury them yet. Please get them a caregiver. This will cushion a lot of challenges that these people are facing. They need caregivers, not just for their health or their drug need. These caregivers act as companion to them. Please don't leave them neglected. Get them somebody today. Thank you very much.
Thank you so much, Doris. One last word, 1 second.
Okay, I would say to everyone listening that it's not just about taking care of your aged parents, taking care of their health and all of that. It's also important that you get them a trained professional caregiver to help manage their medication intake. Of course, give them that companionship because you're not always there. That is one job that they always do. So it is very important. If you want to see them live longer for you, you should do that at every point in time. Thank you.
Thank you, everybody. We thank all of you out there who have been viewing us and following our conversations. Our health awareness series continues next week, and we will be handling other topics. Knowledge, they say, is power, and when you get that knowledge, it's only power if you put it into use. So continue to learn more, continue to implement some of the things you're learning. Of course, we are not prescribing or treating here, so always make sure you consult your doctor with the information that we give you out here. So thank you, and we will see you back on Friday to look at other healthcare issues around people and children who are the most vulnerable in our society. Thank you, and God bless you all.